Hello everyone, and welcome. Today, we're going to talk about a very common vision condition called astigmatism, which affects nearly 1 in 3 people. If you find yourself squinting to read signs or feeling eye strain after looking at screens, even with glasses, you might be familiar with some of the challenges astigmatism can bring. We'll cover what astigmatism is, what causes it, and how it can affect your vision. Most importantly, we'll explore the various ways it can be treated, including traditional options like glasses and contact lenses, and delve into the fascinating world of laser eye surgery. We'll also spend significant time discussing what to expect in the long term if you choose surgery, and how it might impact your eye health down the road. Our goal today is to give you the knowledge you need to make informed decisions about your vision. Let's start with the basics. What is astigmatism? Think of it as a refractive error. This means your eye isn't perfectly shaped to bend light correctly. Imagine a perfectly sighted eye as having a cornea, that's the clear front surface of your eye, shaped like a perfectly round basketball. When light enters a perfectly round eye, it bends uniformly and focuses precisely at one spot on your retina, giving you a sharp image. Now, with astigmatism, either your cornea or sometimes the lens inside your eye has an irregular, mismatched curve. Instead of a basketball, it's shaped more like a football or the back of a spoon, it's steeper in one direction than the other. This uneven shape means light doesn't bend uniformly. Instead of a single focus point, the light rays scatter and focus at multiple points on your retina. This is why your vision appears blurry, distorted, or wavy, whether you're looking far away or up close. Astigmatism primarily comes in 2 forms. Most commonly, we see corneal astigmatism, where the front surface of your eye, the cornea, has that irregular shape. Less commonly, it can be lenticular astigmatism, where the lens inside your eye has mismatched curves. This type can sometimes be connected to the development of cataracts, which we'll touch on later. So, how do you know if you have astigmatism? There are several common symptoms. You might notice your vision is blurry or distorted, whether you're trying to read a book, look at your phone, or see something far away. You might also experience eye strain, discomfort, or headaches, especially after tasks that require a lot of visual focus. Many people with astigmatism find night driving particularly challenging, seeing glare or halos around lights. And if you find yourself frequently squinting to try and make things clearer, that's another common sign. While we don't always know the exact reason someone develops astigmatism, several factors are commonly associated with it. Often, it's hereditary, meaning it can be present from birth and tends to run in families. So, if your parents or siblings have it, you might be more likely to. Sometimes, eye injury or surgery can cause or change astigmatism. For example, a severe injury or certain types of eye operations can alter the cornea's shape. A less common but important cause is a progressive eye disease called keratoconus. In this condition, the cornea thins and gradually bulges outwards into a cone-like shape, leading to severe and irregular astigmatism. We'll discuss keratoconus in more detail shortly. Finally, aging can play a role. As we get older, natural changes in the shape and elasticity of our cornea can contribute to the development or progression of astigmatism. The good news is that astigmatism is a very treatable condition. For many people, non-surgical options are excellent choices for clear vision. The most common solution is eyeglasses. Your eye doctor can prescribe custom-designed lenses that compensate for your eye's unique irregular curvature, making sure light focuses correctly. Contact lenses are another popular choice. For astigmatism, we often use special, toric, soft contact lenses, which are designed with specific orientations and curves to correct the uneven focusing. Rigid gas permeable, or RGP, contact lenses can also be very effective for certain types of astigmatism. A unique non-surgical approach is orthokeratology, or ortho-K. This involves wearing specially designed rigid contact lenses overnight. While you sleep, these lenses gently and temporarily reshape your cornea. In the morning, you remove them, and your vision is temporarily corrected, so you don't need glasses or contacts during the day. Remember, this effect is temporary, and you need to wear the lenses consistently each night to maintain the correction. It's important to know that regular eye drops, like those for dryness, cannot permanently fix astigmatism. They might help with symptoms like irritation, but they don't address the underlying shape issue. It's fascinating how our eyes change with age, and astigmatism is no exception. While some people are born with astigmatism and it stabilizes in young adulthood, significant age-related changes typically begin after your mid-40s. In fact, studies show a very high prevalence of astigmatism in older adults, often affecting 40% to over 70% of individuals. A notable shift occurs in the type of astigmatism. In younger individuals, with the rule, astigmatism is more common, meaning the steepest curve of the cornea is vertical. However, as we age, against the rule, astigmatism, where the steepest curve is horizontal, significantly increases and becomes more predominant. This is believed to be due to natural changes in corneal elasticity and the long-term effects of eyelid tension. The amount of astigmatism can also increase with age, particularly the against the rule type. And another very common age-related condition, the development of cataracts, can also induce or significantly alter existing astigmatism, which is an important point we'll discuss when we talk about cataract surgery. Now, let's briefly discuss a specific eye condition called keratoconus, as it's directly related to astigmatism. Keratoconus is a progressive eye disease where your cornea, that clear front surface of your eye, thins out and gradually bulges outwards into a cone shape. This leads to a severe form of irregular astigmatism and significantly impaired vision. While the exact cause isn't fully understood, it's believed to be a combination of factors. There's often a genetic predisposition, with about 1 in 10 people with keratoconus having a family history of the condition. So, genetics play a role. Environmental factors are also key. The most consistently linked factor is chronic, vigorous eye rubbing. This can cause mechanical trauma to the weakened corneal tissue. People with keratoconus often have allergies or other conditions that cause itchy eyes, leading to that problematic rubbing. Many people with keratoconus rely on specialized contact lenses, like rigid gas permeable, RGP, lenses or scleral lenses, to see clearly. These lenses work by creating a smooth, new optical surface over the irregular, cone-shaped cornea. The tear film between the lens and your eye fills in the irregularities, giving you much clearer vision while you wear them. However, it's crucial to understand that these contact lenses are masking, not curing, the problem. They don't change the underlying shape of your cornea. As soon as you remove the lens, your vision returns to its uncorrected blurry state. Also, contact lenses don't halt the progression of keratoconus. The cornea can continue to thin and bulge over time. In some cases, poorly fitted contact lenses can even cause irritation, leading to more eye rubbing, which can worsen the condition if you're predisposed. To address keratoconus more permanently or to halt its progression, other treatments are necessary. Corneal collagen cross-linking, CXL, is currently the only treatment proven to slow or stop the progression by strengthening the corneal tissue. For some, intracorneal ring segments, INTACs, can be surgically placed to help flatten and regularize the cornea. In advanced cases, a corneal transplant might be necessary to replace the diseased cornea with healthy donor tissue. For many people seeking to reduce or eliminate their reliance on glasses or contacts, laser eye surgery is a highly effective option for correcting astigmatism, often at the same time as nearsightedness or farsightedness. Procedures like LASIK, PRK, and SMILE use advanced laser technology to permanently reshape your cornea, allowing light to focus properly on your retina and give you clear vision. Let's briefly touch on the main types. LASIK is very popular, known for its high success rates and quick recovery. PRK is equally effective in the long term, though with a slightly longer initial healing time, and is often preferred for those with thinner corneas or very active lifestyles. SMILE is a newer procedure primarily for nearsightedness with astigmatism, involving a smaller incision. For higher prescriptions beyond what lasers can treat, implantable Collamer lenses, ICLs, can be a great option, as they are implanted inside the eye and are even reversible. And for older patients who might be developing presbyopia or cataracts, refractive lens exchange, RLE, or using toric intraocular lenses, IOLs, during cataract surgery can correct astigmatism by replacing the natural lens. The best surgical option for you will always depend on a detailed assessment of your individual eye health, prescription, and lifestyle, which your surgeon will thoroughly discuss with you. While laser eye surgery is generally very safe and effective, like any medical procedure, it does carry potential risks and side effects. It's important to be aware of these. Many side effects are common and usually temporary. Dry eyes are the most frequent, often improving over weeks to months, but can sometimes persist. You might also experience visual disturbances like glare, halos, or starbursts around lights, especially at night. These usually get better as your eyes heal. Some discomfort or pain is expected, more so with PRK in the first few days. And it's normal to have temporary blurry or fluctuating vision and light sensitivity during the initial recovery period. Less common, but more serious complications can include undercorrection or overcorrection, meaning you might still have some refractive error or even an induced opposite error, potentially requiring a second procedure. There's also a possibility of regression, where some of the refractive error gradually returns over time. Very rare but serious risks include infection or inflammation. For LASIK, there are rare corneal flap complications, though modern bladeless techniques have significantly reduced these. A very rare but severe complication is corneal ectasia, where the cornea progressively thins and bulges after surgery, similar to keratoconus. This highlights why thorough preoperative screening is so vital. In extremely rare cases, complications can lead to permanent vision loss. Now, let's talk about perhaps the most crucial long-term aspect of laser eye surgery, its potential impact on your future eye health and the diagnosis of other conditions. It's important to understand that laser eye surgery doesn't prevent you from developing age-related eye conditions like glaucoma or cataracts later in life. When it comes to glaucoma, which is often linked to high pressure inside the eye, previous laser surgery can introduce complexities. Laser procedures thin and reshape your cornea. Standard tests to measure eye pressure, called tonometers, rely on the cornea's natural thickness and flexibility. A thinner, altered cornea can cause these tests to underestimate your true eye pressure. This underestimation is a concern because it could potentially mask early glaucoma or delay a diagnosis. However, it's important to know that ophthalmologists are very aware of this. They use specialized formulas and advanced imaging techniques, like OCT scans of your optic nerve, to get a more accurate picture and mitigate this risk. Also, the steroid eye drops you use after surgery can temporarily raise eye pressure in some individuals, so your doctor will monitor this. Generally, having had laser eye surgery doesn't prevent you from receiving future glaucoma treatments if needed, but it's vital your eye doctor knows your history. Perhaps the most critical long-term implication of laser eye surgery relates to future cataract surgery. Cataracts are incredibly common as we age, and almost everyone who has laser eye surgery earlier in life will eventually develop them. The challenge comes with calculating the power of the artificial lens, called an IOL, that needs to be implanted during cataract surgery. Standard formulas for these calculations rely heavily on the natural curvature of your cornea. Since laser eye surgery permanently alters this curvature, those standard formulas can become inaccurate. This significantly increases the risk of what we call a refractive surprise, meaning you might end up needing glasses for distance vision even after your cataract surgery, which can be disappointing if you had laser surgery to achieve spectacle independence. However, there's good news too. Experienced surgeons are well aware of this challenge. They use advanced diagnostic tools, specialized IOL formulas designed specifically for eyes that have had previous refractive surgery, and ideally, your original pre-surgical records to improve accuracy. Newer IOL technologies are also being developed to offer more adjustability. The key takeaway here is the importance of having an open discussion with your cataract surgeon about your laser eye surgery history. So, when you're considering laser eye surgery for astigmatism, nearsightedness, or farsightedness, it's a significant personal choice with both short-term benefits and important long-term implications. Let's recap the key points to remember. First, laser surgery is highly effective but permanent. It provides excellent vision by permanently altering your eye's structure. Second, it's not a cure for aging eyes. Even after successful surgery, your eyes will continue to age naturally. You'll still likely need reading glasses in your 40s for presbyopia, and you'll probably develop cataracts as you get older. The surgery fixes your current refractive error but doesn't prevent these future conditions. Third, complications for future eye care are a real concern, especially for glaucoma and cataract surgery. For glaucoma, accurate eye pressure measurements can be more challenging. For cataract surgery, it's perhaps the most critical long-term implication. The permanent reshaping of your cornea complicates the calculation of the precise artificial lens power, increasing the chance of needing glasses even after cataract surgery. Fourth, remember that alternatives exist. For most people, glasses and contact lenses offer effective, safe, and entirely reversible ways to correct vision without the surgical risks or long-term complexities. Finally, a thorough evaluation is paramount. This isn't a procedure to take lightly. A comprehensive assessment by a highly qualified and experienced ophthalmologist is absolutely essential. They should discuss not just the immediate risks, but also the detailed long-term implications, especially how it might affect your eye care for conditions like glaucoma and, particularly, cataracts. If, after careful consideration and discussion with your doctor, you decide to proceed with refractive surgery, there are two extremely important steps to take to protect your vision for a lifetime. First, keep all your preoperative and postoperative eye records indefinitely. These documents, especially your original prescriptions and corneal measurements taken before surgery, are invaluable for any future eye care you might need. They are absolutely critical, particularly for accurate artificial lens calculations if you develop cataracts later in life. Think of them as a vital part of your eye's medical history. Second, always inform all your future eye care providers about your history of laser eye surgery. This ensures that any eye doctor you see knows to use appropriate diagnostic techniques and interpretation methods, especially when measuring eye pressure or planning for cataract surgery. This simple step can make a significant difference in your long-term eye health and care. We've covered a lot of information today. Whether you're exploring treatment for mild astigmatism or considering refractive surgery, remember that knowledge is your best lens. Understand the trade-offs, ask your provider the tough questions, and choose the path that best protects both your present and future vision. Thank you for your attention. We hope this presentation has been helpful in understanding astigmatism and the long-term impacts of laser eye surgery on your eye health journey.